It's the Real News Network. I'm Sharmini Perez coming to you from Baltimore. The big criticism of Senator Bernie Sanders' health care plan is that it's too lofty and that it would be difficult to implement, and he would never really be able to deliver on the promises. Let's have a look at his plan.
And it is about ending the disgrace, the national disgrace, that the United States of America remains the only major country on earth that does not guarantee health care to our people as a right of citizenship.
Well, advocates in Colorado have some news for those who detract from that plan. If voters in November vote to pass Amendment 69, nearly a $40 billion proposal to implement Colorado Care, it would be the first state to guarantee health care as a human right for all of its residents. Now joining me to discuss this is T.R. Reid. He is the chair of the Colorado Foundation for Universal Health Care, normally in Colorado, but today in Princeton at his class reunion. Thanks for joining us, T.R.
Delighted, Sharmini. Thank you.
So first of all, you have legalized pot, now universal health care. What's going on in Colorado?
You know, Colorado has become a national leader on a lot of policy areas, prevention of teen pregnancy, fracking regulation, as you said, legalized marijuana. You know, with our Rocky Mountains, we're the highest state in the country in more ways than one. And the reason is we're willing to take on problems facing our society and come up with solutions. And then you know what happens? The other states see that it works and copy it. There are now 27 states have legalized marijuana. It's on 7 more state ballots this fall. So when we finally get to universal health care at reasonable cost for everybody, the rest of the country will copy.
And how is it faring? You're campaigning for this, leading up to the fall election on it. How are the people responding to this?
Much better than I expected, frankly. I've been an advocate for universal coverage for a long time, and this group of people in Colorado who wanted to put this plan on the ballot came to me, said, we're going to let people vote, and I stupidly said, oh my God, hopeless. It takes 99,000 signatures to get on the ballot. I said, you'll never do it. Guess what? We got 158,000 signatures because when we tell people what we're doing, they say, hey, where do I sign? It's just a much better idea than the expensive, incomplete healthcare system we're stuck with now in our state.
Now, it's no surprise you're going to get some resistance to this, and insurance companies, hospitals, and groups like Americans for Prosperity are painting a doomsday scenario when it comes to the passage of this amendment. Let's have a look at one of their ads.
Colorado, this could be your future. Long lines, Coloradans suffering, tax increases, no choice. It's what will happen to your health care if Amendment 69 passes.
And how are you responding to ads like this who are saying that there'll be long lineups, tax hikes, and poor reimbursement plans, and so on?
That shows how desperate the health insurance industry is. I mean, they have a lot of gall complaining about no choice. It's the health insurers who came up with these narrow networks where they tell you what doctor you can see. Guess what, Sharmini? In our law, it says right there that the patient can choose the doctor, the chiropractor, the lab, the hospital. We pay them all. It's the insurers who limit choice, but they say that stuff because they're terrified that we're going to pass. And if we pass, they would have to reduce their premiums and offer better care, which they definitely don't want to do.
And what's the link between those who are running these ads and those who are supporting the Hillary Clinton campaign? There's been some articles in The Intercept about how the super PACs are banking Hillary in order for her to shy away from such a plan as what's going forward in Colorado.
I've seen those. I think those articles are wrong. I think it's kind of a stretch to say that. Hillary Clinton has always favored health care for everybody. She says it's a moral imperative that we care for people when they're sick. I'm certain that Hillary Clinton in the general election is going to endorse our plan because this is the cheapest, most efficient way to get one state in America to universal coverage. And then when we do it, the rest of the country will follow.
And like it was when President Obama was running, there was a lot of negotiations at that time, particularly in 2008, about the universal, about a healthcare period and the various options that the candidates laid out. But at the end of the day, President Obama shied away from any plan that he had actually supported in the campaign, and largely because of the insurance company or the pharmaceutical companies and their role in the campaigns. And we saw that becoming a reality after he got into office. Why do you think Hillary's not influenced in the same way?
Well, I think Hillary learned from the experience of Obamacare. Obamacare absolutely expanded coverage, but because they had to make all those compromises with the insurance companies and big pharma, it leaves 33 million people with no health insurance. 370,000 people in our state of Colorado have no health insurance. So we're not cutting any deals with the insurance companies. They can still compete against us if they can offer a decent product at a reasonable price, but they're trying to kill us. And what I say, my best argument is, I say to people, the health insurance industry hates this. You'll love it.
And what about pharmaceuticals? Now, in places like Canada, the prices of drugs are much lower than it is here because the state actually negotiates the price of the medicine. And here it's sometimes 10, 20 times higher. Will Colorado carry out a plan to negotiate like that?
Well, we think we're going to have 4.83 million people in our plan, which should give us some negotiating clout over the big pharma. But you know what, Sharmini, I'm not sure we're big enough. I think if we say we're not going to pay your outrageous price, they'll just go to some other state. Now, if California would do this or New York would do this, big pharma would have to fold. I'm not sure we'll have the negotiating clout to get big pharma to cut its outrageous prices.
Well, maybe if it is adopted in Colorado, other states will follow suit. I thank you so much for joining us today, TR.
Thanks for having me on your air, Sharmini.
And thank you for joining us on the Real News Network.